I'm going to do a cystocentesis on Penny, and I have a 3 ml syringe with a 22 by 1.5 gauge needle. I'm going to put alcohol in the area. And I'm going to palpate the bladder. I'm going to go to the midline, straight down.
It's okay, sweetheart.
And then let go of the plunger and pull out. And then I'm going to put it into my pre-labeled urine tube.
Hold it.
I'm going to simulate putting in a urinary catheter in a dog. So I have my sterile gloves, so I would be putting on my sterile gloves. And I would have my assistant extrude the penis, and I would clean it with my Chlorhex, and then rinse it off with my sterile saline. I would hold the catheter up against his body, make sure that it's the appropriate size, and kind of make sure I know where I want it to stop. And then I would lubricate it with my sterile lubricant, and I would pass it in slowly to not traumatize anything. And then once I was getting urine, I would get the urine from the catheter with my syringe, and I would slowly pull the catheter out when I was done, and put the urine into a labeled urine tube. And then if I'm not going to use it within 30 minutes, then put the urine into the fridge. I'm going to be simulating putting in a urinary catheter in a cat. So normally the cat would be sedated for this. So I would use my sterile gloves, which I have right here. And so I would have my assistant extrude the penis, and I would clean it with my Chlorhex, and then I would rinse it off with my sterile saline. And you would hold up the catheter to make sure that it seemed the appropriate length, and if it is the appropriate length, then you would use your sterile lubricant to lube the end of it. Gently pass it through. When it's in the bladder, I would take my syringe and I would get the urine out of the catheter with the syringe, and then I would slowly take the catheter out to make sure I didn't traumatize anything. And then I would put the urine into the urine tube, and I already have the name on there, and I would make sure that if I don't use it within 30 minutes that I put it in the fridge. To simulate putting in a stomach tube, so first you want to measure. You want to measure from the canine to the 13th rib. So once you get your measurement, then use a piece of tape so that you know where to stop the tube once you have it inside. And I've got a piece of tape used as a speculum. So it would be a lot shorter if I was actually using it. And so you would lubricate the end of the stomach tube, pass it through the speculum, and then once you got to your tape, that's where you know you want to stop, and you want to make sure that it's in the stomach. So you put some sterile saline, listen for a cough. You can also feel that there is a trachea and then the tube next to it. And so once you know that you have it in, you would put the medication in. So once you put all the medication into the tube, then you seal off the end of the tube and then pull the tube out.